Ladies and gentlemen, I have been in business for more than 30 years. And one thing that I have found out in over 20 years of being a, a visionary leader in the mental health and behavioral health is that even in their executive and management capacity, in the hiring and firing decisions, and in the review of processes, and also in the performance reviews of people and across different entities where that being in such roles, either in as a compliance officer or even in the areas of quality assurance, in the areas of management and the whole areas or what we call the four walls of healthcare administration is that having a degree in any area of behavioral health and also having a license does not make one a good clinician. We've seen time and time and time and time after people who are graduate and licensed coming to work, but they are not able to perform the procedures that they are licensed to do. Because most of the time people come out of school or rely on what they were taught in school. And even during the clinical rotations, when they were supposed to have, through internship, gain some experience, and they've not been able to live up to the demands of the task. And then I look at it legalistically from the law and regulatory aspect of it, where all procedures are stipulated of what they will be doing. So we might tell you, well, they say you are going to conduct an assessment within no later than the fifth visit, seeing a patient, and then, but you are trained to conduct those assessments. But in conducting those assessments, then it specifies all the areas the procedure will cover, what you should do, and etc. etc. But your training tells you how to do them. Now, using the tools that is available, which is oftentimes standardized, especially in accredited organizations and facilities like ours, you will have also some performance and measurement criteria that has to be made in order to show whether the person performed the services that complies with those standards or regulations. So oftentimes you find that the clinicians were not prepared and they come to you discussing classroom work, research of what they have been taught in school. But and often we tell them, but that is in a perfect scenario. All the research that supports any evidence based procedure that you perform is done in a laboratory environment where all controls are in place and measured in order to determine the efficacy of the procedure, the process. So, but when you are dealing with human beings, everybody is different and respond to situations differently. For example, depression. How do you diagnose a depression? It gives you this criteria, assuming using the standard in the ICD-10. So these three criteria has to be present, and in addition to any five from this list of other criteria. And assessing those particular criteria is what you obtain from training. Now, in doing so, you will realize that it's not the same for everybody who is suffering from depression, because some people's response and reactions are different, and how it affects people are all different. And there is beyond what you can just only learn by looking at that. There are different things that can make some of those conditions not apparently available at the time. But what if the person decides to hide it and keep those other things from you because they don't trust you? Why should I tell you my business, as in the case with most black people in the world, and especially African Americans, that we want to first of all gain your trust, which might even take 6 months or a year, or a day, depending on how the person feels in the person who is interviewing the individual during that particular assessment. Then the how you also conduct the assessment is also another factor that could have a different nuances, different from what a laboratory experiments that you learned in school offers you. Say, for example, in our organization, we have adopted the motivational interview technique, which is one of the latest technology in that particular process. But what if the person is a nurse or who has been in practice as a physical a nurse in a hospital or in a nursing home, or a doctor who themselves don't have not gained the experience, or a social worker, professional counselors. And then you find that, for example, nurses that like to use the reductionist or reductionist approach or model in the way they conduct those assessments, ask questions that is confrontational, sometimes in a way, especially you talk about doctors that have no bad manners, have no consideration for the person's feelings and emotions as far as how that information that is observing to see whether you are empathetic, whether you're understanding, whether you're going to be judgmental, and the person is analyzing you to see whether they will give you the answer you want or tell you what you want to hear. So you can see how there are different nuances in the real person when you do those assessments as a clinician. So you find that you can be the best clinicians in class and graduate with first class or summa cum laude, and then you are now dealing with a human being that also analyzing you and wondering and considering whether they need to tell you what you need to do in order to make that determination. So that is why here at Care Solutions in our training and orientation, so we have seasoned clinicians, some with a combined experience of probably 50 or 100 years, to be able to guide you and help you when you run into trouble, which is not obtained in a lot of other behavioral health or mental health locations. To be able to see how motivational interview techniques or other techniques can help you to create the kind of trusting and environment, trusting relationship that will allow the bonding, the therapeutic environment that is required, that will allow somebody to put their guards down and actually tell you what is going on from inside of them. Remember, this is about the mind, the brain, and the mind. So that is why